Welcome to my channel. Gestational diabetes is one of the most common complications during pregnancy. Many expectant mothers are diagnosed with diabetes during this period. In this discussion, we will cover the following. 1. Why does diabetes occur during pregnancy? 2. What complications can arise if a pregnant woman develops diabetes? 3. How can gestational diabetes be prevented? Let us begin. What is diabetes? To sustain life, we consume food, which provides an essential nutrient known as glucose. This glucose is absorbed from the digestive system into the bloodstream, increasing blood glucose levels. Glucose is the primary source of energy for body cells, but it cannot enter cells on its own. The hormone insulin, secreted by the pancreas, enables glucose to move from the bloodstream into body cells, where it is utilized to produce energy. The normal blood glucose levels are as follows: random blood sugar, RBS less than 7. 8 millimoles per liter 2 hours after breakfast, 2 HABF less than 11 millimoles per liter. When blood glucose levels rise above the normal range, the condition is referred to as diabetes mellitus. If this increase occurs during pregnancy, it is known as gestational diabetes mellitus, GDM. GDM typically develops during the second or third trimester of pregnancy. Why does diabetes occur during pregnancy? 1. Hormonal changes in pregnancy. During pregnancy, the placenta, or placental tissue, produces several hormones, such as A. Human placental lactogen, HPL, B. Progesterone, C. Estrogen, D. Cortisol, E. Placental growth hormone. These hormones ensure that sufficient glucose is available in the maternal bloodstream for transfer to the growing fetus. However, they also reduce the effectiveness of insulin, a condition known as insulin resistance. As a result, glucose remains in the mother's bloodstream instead of entering the cells. This leads to elevated blood glucose levels and ultimately results in gestational diabetes. Complications of gestational diabetes. Gestational diabetes poses significant risks for both the mother and the baby. Complications for the baby. 1. Macrosomia, excessive fetal growth. When the mother's blood glucose is high, glucose easily crosses the placenta, increasing the baby's blood sugar levels as well. This stimulates excessive growth, leading to a large baby and macrosomia. Neonatal hypoglycemia. After birth, the baby no longer receives glucose from the mother, yet the baby's pancreas continues to produce high levels of insulin. This causes a sudden drop in blood glucose after delivery, known as neonatal hypoglycemia. If not treated promptly, this condition can be life-threatening for the newborn. Complications for the mother. 1. Difficulty in normal delivery. Due to the baby's increased size, normal vaginal delivery becomes difficult, and cesarean section is often required. Poor wound healing. In diabetic mothers, surgical wounds, such as those from a cesarean section, tend to heal slowly and are prone to infection. Future risk of type 2 diabetes. Women who develop gestational diabetes have a significantly higher risk of developing type 2 diabetes later in life, as their insulin response is already impaired. Prevention of gestational diabetes. Although gestational diabetes can cause complications for both mother and baby, the good news is that it can be prevented through proper diet, exercise, and regular medical checkups. Risk factors for gestational diabetes. Women are more likely to develop GDM if they have any of the following risk factors. A. Overweight or obesity before pregnancy. Women who are overweight before conception have a higher risk of developing GDM. B. Family history of diabetes. If a close family member, parent or sibling, has diabetes, the risk of GDM increases. C. Previous history of GDM. Women who had gestational diabetes in a previous pregnancy are more likely to develop it again in subsequent pregnancies. D. Advanced maternal age. Women who conceive after the age of 25 are at increased risk. E. Associated medical conditions. Conditions such as high blood pressure, hypertension, or polycystic ovary syndrome, PCOS, increase the risk of gestational diabetes. Preventive measures. 1. Maintain a balanced diet during pregnancy. Quality of food is more important than quantity. Eat 5 to 6 small meals a day instead of large portions. Avoid fried, oily, and high-fat foods. Replace white rice with brown rice, red rice, or oats. Eat plenty of green leafy vegetables and fiber-rich foods. Consume fruits, but limit high-sugar fruits such as bananas, mangoes, and jackfruits. Drink adequate water throughout the day. Engage in regular physical activity. Light physical exercise helps regulate blood glucose levels, prevent excessive weight gain, and reduce stress. For pregnant women, walking is the safest form of exercise. Try to walk for at least 30 minutes daily, under medical supervision. Maintain a healthy weight. Excess body weight before or during pregnancy increases the risk of gestational diabetes. To maintain a healthy weight, avoid fast food, soft drinks, and sugar-rich snacks. Monitor blood glucose levels regularly. Gestational diabetes is usually screened between 24 and 28 weeks of pregnancy using the oral glucose tolerance test, OGTT. Regular testing helps detect diabetes at an early stage. Ensure timely management through diet or medication if necessary. Reduce stress and ensure adequate sleep. Stress and anxiety can disrupt hormonal balance and raise blood sugar levels. Therefore, manage stress through relaxation and breathing techniques. Get 7 to 8 hours of sleep daily. Regular health checkups. Monitor blood pressure, body weight, and urine periodically during pregnancy. Regular follow-up helps detect any early signs of gestational diabetes or related complications. I hope today's video was helpful for you. If you find the video helpful, don't forget to share it with your friends. Please subscribe to the channel to get health advice, health awareness, and reproductive health-related videos. And remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.